Hi, Dr. Kevin Windisch again from Sparks Pediatric and Adolescent Medicine. Welcome to our educational series for professional students. We can be reached if you'd like to schedule a rotation at 775-359-7111, and you can find us on Facebook at www.facebook.com/sparkspeds.nv, N as in Nancy, V as in Victor. Today we're going to talk about the differential diagnosis of the red eye in slightly older children. We're really not interested in the neonates. I have 3 students who will be off camera talking, student 1, student 2, and student 3. So student 2, they wish to remain anonymous. So student 2, tell me about some of the things that are in the differential diagnosis of the pink eye. And please realize this is hardly complete. There's lots of weird things that can do this. We're just looking at some of the most common things.
So there's a viral conjunctivitis.
Okay, and that's probably the most common, especially this time of year in the winter.
Bacterial conjunctivitis.
Okay.
And then foreign body.
Okay, and that one's people forget about, but definitely very, very common. And nasty. I had a kid who had, mom called saying, I just need drops called in for pink eye. I said, we don't call in antibiotics over the phone, you need to be seen. She was pitching a fit, came down here. I looked in the kid's eye, lit it up, and there was something on the eye that was just staring back at me, and it was so bright under the woods lamp I couldn't tell what it was. So I sent him to Opto, got him in the same day. It was metal shaving from Metal Shop, and he had forgotten about that he got it in his eye 3 days ago. Fortunately, ophthalmology was real clear to mom. Had your doctor given you eye drops, you would have gone blind. You'd have lost, and probably lost that eye, so you're welcome. That's why I don't treat pink eye over the phone, ever. What else?
So that's also corneal abrasion. Herpetic conjunctivitis.
Absolutely, and albeit uncommon, you do need to pay attention for that, because it's scary when it happens.
So some of the other ones like irisitis.
Okay, iritis.
Iritis, okay, said that wrong. We're on there.
Okay, and iritis is not rare. I have 3 patients that have had iritis.
But then it went on to say that it could be caused from herpes, CMV, or toxoplasmosis, or immunosuppressant.
Yeah, I mean, you know about the immunosuppression because that doesn't just happen. You have to give them something to immune suppress them. And definitely, you need a good ophthalmologic exam to rule some of that out. But it tends to be kind of a weird pink eye. It's not like your typical conjunctivitis with just a lot of goo. The eye is really red and really angry, and the patient's really photophobic. Some of which may not come across over the telephone.
Right.
And that's going to be your hint that you need to get this patient in with ophtho. Other things that'll do that besides infectious iritis or infectious episcleritis will be rheumatoid arthritis, okay, or other autoimmune diseases of the eye, and both of those need to be treated. They need to be treated with high-dose steroids or you'll lose vision.
Right, and that's why you have to see the eye, because you wouldn't want to give steroids to somebody that had herpetic.
Absolutely. Having said that, I will argue that in primary care, Pred Forte, which is steroid eye drop, should not even be in your vocabulary. That should be prescribed only by ophthalmology. But your job is to decide whether this patient needs to get in and see the ophthalmologist right away. Okay, what else?
Another thing they mentioned was possibility of Kawasaki syndrome.
Absolutely, especially in a kid who's got a little bit of fever and had fever for a couple of days. That was something I was really looking at with our patient who had fever over the last couple of days that we saw earlier today.
That's what you were concerned about, but he didn't have the typical rash.
He didn't have any of the other findings, he just had fever.
Okay.
What else?
Nasal lacrimal duct obstruction.
Right, the eye, in that case the eye shouldn't actually be red, it's just goo.
It's just goo.
But because parents associate goo with conjunctivitis, it's still in the differential diagnosis of conjunctivitis, but not of a red eye. If the eye is red, that's not a nasolacrimal duct obstruction.
Okay.
Okay, what else?
So periorbital cellulitis?
Absolutely, and that needs to be treated with systemic antibiotics. Okay, and it's not too distant cousin, orbital cellulitis.
Orbital cellulitis, okay. Am
What
I
else?
missing something?
Glaucoma.
Well, yeah, I mentioned that
Okay.
the last time we talked.
Okay, so yeah,
glaucoma,
for
yeah.
the sake of the video, glaucoma.
Glaucoma.
Is another one that can do that. Those are probably the big ones that you really want to worry about.
Okay.
But, you know, most people don't give that much thought. And then kind of, it's not so much, well, I guess it is sort of its own differential, is otitis conjunctivitis syndrome caused by non-typable H flu.
Okay.
If you don't look at the ears, you're never going to pick it up. And a lot of these kids are not complaining of earache at the time that they present, and giving them the eye drops won't treat the disease.
Yeah, they need a systemic.
Yeah, because you got to treat the ear as well.
Okay.
And it's because of these things, and especially because of the JRA and other autoimmune disease connection, I really want to see these kids because they're mildly ill appearing.
Mm-hmm.
And that doesn't come across over the telephone. And even my kid who had the foreign body in the eye, he swore up and down there was no history of foreign body. He'd forgotten about it until he saw ophtho later that day.
Mm.
So, you know, and mom was just certain it was pink eye and was just insisting that I give antibiotics. And I don't. When I walked in the room, so what can I do for you? So I don't know why I'm here. He has pink eye, and they just wouldn't give me drops. Was exactly what she told me.
Mm.
Good thing we saw him. Wow. That one kind of scares me because I know lots of people that would have treated that over the phone. I won't. And 99 out of 100 of these are something that either won't respond to drops or won't get worse with drops. So, 99 out of 100 times you can skate, and parents are happy, and you've made them happy if you call in the drops over the phone and you haven't hurt the patient. But boy, that 1 out of 100 has some really bad potential. And I guess we should mention corneal ulcers on the list, because we mentioned corneal abrasions, and of course the abrasion that's allowed to then get infected becomes an ulcer. Those are really scary. Those need to be treated with systemic antibiotics often as not, and definitely need to be followed by ophtho. So I hope this has helped to be enlightening for you guys, because one of the skills as a professional student you need to develop is an expanded differential diagnosis. Yeah, horses are common, but you do need to look for zebras. And common things, there are lots of other things that enter into this. Things are not as simple as they often sound at first glance, definitely not as simple as patients think that they are. And these are the things you need to consider when deciding how you're going to manage a patient. This is Dr. Kevin Windisch. Again, we can be reached at 359-7111. That's area code 775. We'll see you next time.